Respiratory illnesses have long challenged global health systems, but one virus is quietly making its presence felt: human metapneumovirus, or HMPV. Recently, a surge in cases in China has sparked international concern in this program. We'll explore what HMPV is, the current global situation, and measures to prevent its spread. Human metapneumovirus is a respiratory virus first identified in the Netherlands in 2001. Scientists believe it may have been circulating in humans for over 50 years. Like its more well-known cases, respiratory syncytial virus, human metapneumovirus primarily affects the respiratory tract. It's spread via respiratory droplets, direct contact with infected individual, and contaminated surface. Symptoms include cough, fever, nasal congestion, and in severe cases, sneezing and shortness of breath. Vulnerable groups such as young children, the elderly, and those with weakened immune system are at higher risk of severe complications, including bronchitis and pneumonia. Recently, northern China has witnessed a significant rise in human metapneumovirus cases, particularly among children under 14. Hospitals have reported being overwhelmed as the respiratory season reaches its peak. While this surge has sparked international concern, the World Health Organization has clarified that the outbreak aligned with seasonal patterns seen in respiratory illnesses. Local health authorities have ramped up screening and isolation measures to curb the spread, particularly in schools and children's centers. Human metapneumovirus is not confined to China. Countries like United States, India, and Australia have also reported cases in recent months. In the U.S., the Centers for Disease Control and Prevention has noted an uptick in cases, but emphasized that infection rates remain with pre-pandemic levels. Health experts believe the increased awareness and improved diagnostic technique might explain the apparent rise in global cases. Meanwhile, in Australia, where human metapneumovirus is a no-seasonal virus, cases have been consistent with previous years. However, public health officials caution that new variant or co-infection with other respiratory viruses could increase the burden on healthcare system. In Pakistan, human metapneumovirus has been detected since 2001. While no significant have been reported recently, the country's proximity to China raises concerns. Pakistani health authorities are closely monitoring the situation. Flights arriving from China are being screened, and hospitals are not alert for respiratory illness. Awareness companies emphasize the importance of hygiene and prevention measures, particularly for children and the elderly. Human metapneumovirus presents several challenges. First, there is no specific antiviral treatment or vaccine for the virus. Management focuses on supportive care, including hydration, rest, and over-the-counter medication for symptom relief. Second, its symptoms overlap with other respiratory infections, such as RSV, influenza, and COVID-19, making accurate diagnosis essential but challenging. Rapid diagnostic tests are available in some regions, but access remains limited in others, particularly in low-income countries. Preventing the spread of human metapneumovirus relief on public awareness and adherence to simple yet effective practices. Regular hand washing with soap and water for at least 20 seconds is crucial. Alcohol-based hand sanitizer can also be effective. Always cover your mouth and nose when coughing or sneezing, using a tissue or your elbow. If someone exhibits symptoms of respiratory illness, maintain a safe distance and encourage them to seek medical care. In crowded or high-risk settings, wearing a mask can reduce the spread of respiratory droplets. Frequently touch the surfaces, such as door, handles, phones, and counter, etc., should be cleaned regularly. Public health agencies play a pivotal role in managing human metapneumovirus and other respiratory viruses. The World Health Organization monitors global trends, provides guidance to member states, and coordinates research on potential treatments and vaccine. In the U.S., the Centers for Disease Control and Prevention conduct ongoing surveillance, shares data with international partners, and funds research to understand the virus better. Similar efforts are underway in other countries aiming to improve diagnosis, enhance treatment options, and strengthen healthcare infrastructure. Scientists worldwide are exploring ways to develop the specific treatments and vaccine for human metapneumovirus. Recent advancements in messenger RNA vaccine technology, which proved successful during the COVID-19 pandemic, offer hope for future human metapneumovirus vaccine. Meanwhile, global collaboration and investment in healthcare systems remain crucial to mitigate the impact of this and other respiratory viruses. Human metapneumovirus is not a new threat, but recent searches highlights the importance of vigilance and preparedness. While the current situation is under control, it's severe as a reminder of the need for robust healthcare systems and global collaboration. By staying informed, practicing prevention measures, and supporting public healthcare efforts, we can protect ourselves and our communities from human metapneumovirus and other respiratory illnesses. Together, we can overcome these challenges and build a healthier future.